Spectrum, which is a book that basically describes all the different diagnoses an individual could have related to mental health therapy. And where it derives from is years and years of research, years and years of studies of people collaborating together and realizing, you know what, some people have these same symptoms. And based on the symptoms they present with, will determine what diagnosis they have to give to my clients. Because I have a lot of parents coming in asking, how do you know what my child has? How can you make a diagnosis? How do psychiatrists figure out what it is that my child is experiencing? And the way we like to describe it, or one of the ways I like to describe it, is to give an example of going to the doctor. So you go to the doctor and you tell them, I have a sore throat, I have a runny and stuffy nose, and based on what you describe, the doctor will say, okay, you have a cold. And so based on those symptoms, based on the things that you presented with, he's able to give you a diagnosis of a cold. And it's the same thing with mental health. When a client comes in and they say, my child is experiencing this, they're going through these symptoms, based on the symptoms that they present with, we're able to give them a diagnosis. To be more specific with PTSD, there are certain qualifications for an individual to be diagnosed with PTSD. And one of those is trauma. There has to be some sort of traumatic event. And traumatic events can vary from person to person. It could be anything from abuse to witnessing some sort of violence to vehicle accidents to war, or even experiencing natural disasters such as a tornado like in Oklahoma or a hurricane. And after that, what many times happens is after a traumatic event, symptoms will begin to develop.